two, two, one. You're live.
Yes. Hello, everybody. It's Dr. Alex Earl here, and it's Hump Day with Dr. Alex Earl. And it is the first Hump Day of 2024. Woo! All right, so we're super excited to kick it off this year. Some of you, a lot of you know me, you've been following me for a long time. Some of you may not. But every Wednesday, every Hump Day, I get on and do a live, and we talk about all sorts of plastic surgery topics. We talk all about the procedures, about the pre-op care, post-op care, pretty much anything regarding, related to plastic surgery from head to toe. All right, and it's very good, reliable information because it's coming from a double board certified plastic surgeon. All right, so we delve into several topics, and today, as the first live and first Hump Day of 2024, I want to talk about a technology which I started using towards the end of last year, and I've seen that it's been truly exceptional. Almost, I would say, a game changer. And for that reason, starting now, moving forward in 2024, all those that are going to be booking a lipo case with me or a BBL with me, the Vaser is going to be part of your surgery. Basically, it's no longer something that's elective. It's going to be something that is mandatory, okay? Because I've seen it now, I've used it for the past few months, I've seen the results at 6 weeks, 3 months, 6 months. That's as much as we have. We use it for the past 6 months, and the results have been truly excellent. So I'm really liking it a lot. So let's talk about it a little bit more, okay? So what I'm talking about is the Vaser, which is this machine that you see behind me right here. And the Vaser, what it does is that it uses ultrasound energy, okay? So sonic waves, think of it that way. Sonic waves, ultrasound energy, all right? This is different than ultrasound imaging, okay? You gotta make sure you know that distinction, all right? Ultrasound imaging is what I've been using since 2019 for the BBLs, right? I use the ultrasound so that I can see exactly where I'm placing that cannula I make sure that it's in the safe space and that we avoid any potential fat embolisms or any problems like that, all right? So that's ultrasound imaging, and that's when I use an ultrasound to actually have an image pop up on the screen where I can see exactly where my cannula is, okay? This is different. This is not the same thing, all right? This is using ultrasound energy. It's using sonic waves, and what that energy does is that it helps basically release the fat. The technical term for this is emulsify. So it helps emulsify or release the fat from the surrounding tissues. Okay? So you put this wand in, and we're gonna be doing a little show and tell here in a second. But you put the wand in, right? You turn it on. You can actually hear the vibrations of that ultrasound energy that's coming through. And so those vibrations, once they're inside the tissue there, it knocks off the fat cells from the surrounding tissues. So it releases the fat cells, it emulsifies the fat cells. It does it in a way where there is less bleeding, okay, and several other advantages that we're going to talk here right now, okay? So how does it work? Well, it's an extra step in the liposuction process, okay? So typically what happens when you do liposuction, right? Some of you may know, but the first step is that we gotta infiltrate what's called the tumescent solution, right? So this is a basically normal saline or lactating ringer solution that we're putting into the tissues. That's step number one. And then in your traditional liposuction, step number two is the actual liposuction portion of it, which here at Pure we use a power-assisted liposuction, which is a liposuction with the micro-air, okay? And then that's it. And then step number three, if you're gonna do fat grafting, is that you separate the fat from the rest of the fluid, and then you use that fat for your fat transfer, okay? Now we have the Vaser, which was gonna be an additional step. So it does add some time to the procedure. It typically adds, if we're doing front and back Vaser, it typically adds about 30 minutes. 15 minutes in the front, about 15 minutes in the back, okay? So it does add more time, but I think it's well worth it. So now when we're doing the liposuction, we still do the first step, which is infiltrating that tumescent solution. It's the one that comes out of the IV bags like this, okay? And what we do is that we put some epi in the IV bags, which is the medication that's used to constrict the blood vessels so that there's less bleeding, right? So that's step number 1. And then step number 2 is actually using the Vaser. So that's step number 2. The Vaser goes in and helps release that fat, okay? And then step number 3 is the actual liposuction part of it, which we again still do it with the power assisted liposuction with the micro air, okay? So you're adding that additional step. Now, what are the advantages to the Vaser? It has several very important advantages, okay? Number 1 is that there's better skin retraction and smoother skin retraction. So better and smoother skin retraction. All right? Why is that? Because overall when you use the Vaser, there's less inflammation, okay? And also those sonic waves, right, that ultrasound energy does impart a little bit of heat underneath the skin, and so that causes a little bit of an inflammatory reaction just beneath the skin, and that helps the skin retract better and also in a smoother way. So there's better skin retraction. Overall, there's less inflammation because there's less trauma, right? The Vaser helps dislodge those fat cells, and then the fat cells come out a lot easier, a lot smoother, and with less trauma. And we can even actually put the suction down from what we typically do because the fat comes out so easily. So there's less suction, less trauma, less inflammation, which are all advantages, and all that also helps the skin retraction, okay? We can actually have more fat removal, and so that's why the Vaser works really, really well with our thin patients also, right? Because for the thin patients, right, we're always struggling trying to get enough fat out, but when you have the Vaser, because it really kind of dislodges these fat cells and makes it easy to remove, we're able to remove a little bit more fat when we use the Vaser. So obviously now I'm doing it for all our patients, but it especially works especially well for our thinner patients and for our HD, high definition liposculpture patients. Because when we do HD, remember, there's certain areas where we have to remove quite a bit of fat, really thin things out, so that we can create those contours for that athletic look. And so the Vaser really helps remove those little extra fat cells from that area to really create that beautiful athletic look, okay? And because it's helping release the fat cells from all the surrounding tissues, it helps release the fat cells from the surrounding blood vessels as well. And therefore, like I said, less suction, less trauma, less inflammation, and less bleeding, which is great. So now we have another tool that helps decrease the bleeding or the blood loss for the case. And then of course we are always using our cell saver. That's also mandatory for all of our big lipo cases and BBLs. So we have now a few things which are now mandatory, but I think it's all for the benefit of the patient, right? So the ultrasound imaging for the fat transfer, I've been doing that since 2019 and do that for 100% of my BBLs. The cell saver, I do it 100% of my Lipo 360s and BBLs. And now, starting in 2024, for everyone that's coming in, for all the new patients coming in, Vaser is going to be included as well, all right? So, as many as you know, our prices went up this year, and if you didn't take advantage of it in the last month, I'm sorry, we told you every single day for like at least 30 days or so, right? Every single day we're telling you, hey, prices are going up. So, well, it's a new year, prices went up. But the good news is that that even though the prices went up, you're getting Vaser in that price, included in the new price. Okay? So you're getting a lot of advantages there. All right, so, what does it look like, right? You guys are like, oh, just show me the device. So I have it right here. So I'm going to move this here a little bit. But as you can see here, this is the device. This is the box here. And so there's two modes here. There's that V mode, which is the Vaser mode. And that's a little bit of a less aggressive mode, okay? And then if I press this button here, you can have the C there. Excuse me, that's continuous mode. That's a little bit of a more aggressive mode. And you typically wouldn't use the C mode if you're doing fat transfer. So this is one of the things that has changed, and this is a newer version of the machine, right? And now you can put it certain settings where you are able to use the fat for transfer, which is great, which is why we started using it. You may have heard me talk about Vaser perhaps, I don't know, 2 years ago or so. And at that point in time, I wasn't so hot about the idea because at that point in time, the Vaser would run a little bit too hot, and the worry was that it would melt the fat cells, and then the fat cells wouldn't be viable for transfer, okay? But that is no longer the case. Now I can put this here on that V Vaser mode, and I can switch down how high the intensity is. You can go, and right now, can you see the numbers from there? It's too hard. But
yeah, 80.
It's a little bit tough, but right now, you can go all the way up to 100. No, way too high, right? Especially if you're doing fat transfer, but it can go that high. But when we do fat transfer, we want to crank it down to 70, okay? So these are the settings that are good for fat transfer. So we have it on Vaser mode and on 70, and when we do that, we still get all the advantages that we have here, okay? But we also get viable fat cells for transfer, which is of course the goal, all right? So this is the wand that we use. So that if you kind of looks almost like a lipo cannula, but it doesn't, it doesn't suck. It's actually solid. It doesn't have any holes in it, because through here is where the sound waves come. And I think it's really cool. I mean, I think it looks like a lightsaber. Any Star Wars fans out there? Yeah. All right, it's like my lightsaber now. And so I gotta get one with like a purple handle or something like that, like Mace Windu. All right, okay, just dorked out there a little bit, no worries. But here we go. So you can actually hear it, okay, because it's ultrasound waves, okay? So you can hear it and see it. So here we go. You guys ready? You hear that? Stop. Those are literally the ultrasound waves there, okay? And you can
One more time.
There you go. And so you have the wand here, okay? And you can switch out the wands. It can be longer ones, shorter ones, more intense or less intense. That's another thing, another variable. You want to have the wands with either 2 or 3 rings for fat transfer once again. And I'm going to show you what it sounds like outside the water. You shouldn't do it too much outside the water, but just so you guys listen to this. Hear that? Yeah, there you go. And there it is inside the water. You can see the water moving. Look at that. That's what shows you that it's actual energy that's going through there. Okay? So that's the way that it works. It's actually, underneath the skin, just like a lipo cannula would be. And we just pass that underneath the skin, impart the energy, loosen up the fat cells, and then you get all the advantages here. Okay? Once again, it's going to be mandatory for everybody, so it's included in the new price. Okay? It works very well for everyone, but especially well for our skinny BLs, our South Beach butt lifts, and our high definition cases, and of course the pure total definer package. All right, it's going to be included, of course, in the pure total definer package. That's the package that includes your high HD or high definition liposculpture. It includes the Vaser. It can also include Body Tight and Morpheus if we want further skin retraction. It will include fat transfer for women, hips and buttock, for men into other muscle groups to bulk up those muscle groups like the pecs, the biceps, triceps, shoulders, etc. So all those things are included in that package, but I'll leave the details for another hump day, probably coming up in the next couple of weeks. All right? Okay, so that's about it in terms of the information, so I'm happy to answer any questions.
Let's start with TikTok.
Yes.
First a comment. You did my surgery, Alex. Thank you so much. Best surgeon out there.
All right. Yes. Well, I'm glad you're doing great. And make sure to send us some follow-up photos. We love to get those. All right.
Okay. High def arm lipo. I'm looking for plastic surgeon.
Okay. Great. So that also works well with this. Okay. So when you're doing a high definition arm lipo, you need to, once again, you need to remove quite a bit of fat from certain areas so that we can really define those arms and really define the musculature of the arms, okay? And so in order to be able to really remove that fat well, to be able to remove more of that fat and for the skin to retract nicely, the Vaser helps. So when we do that high def arm lipo, we are going to be using this device as well. And we do it in a little bit different ways for men and women, okay? So for women, of course, women want to remove a lot of the excess fat, especially in this lower part of the arm here, and also kind of along this area here, what we call the subaxillary area. But they don't necessarily want like that super defined bicep or tricep. And then in men, though, we can actually quite define the musculature there, and if the patient wants to, we can even enhance the musculature by doing a little bit of fat transfer into the bicep or the tricep or the deltoid, which is the shoulder muscle, to enhance those muscles even further.
Okay. Those Vaser. I'm sorry. Can I add arm lipo to my skinny BBL without adding additional scars?
No, I mean you're gonna need the scar for the arm lipo, right? So if we're just doing the trunk, all the scars in the trunk area. If we're gonna be doing some additional lipo to the arms, then we have to put typically an additional incision, which is really right there at the elbow region. Now, one of the keys to someone that's been doing this for a very, very long time is that you really want to make sure that the scars are all in areas that are going to be very well hidden, okay? So when you do that little incision in the elbow area, if you do it in this little kind of loose skin in the elbow, right in there, it's basically, it fits into one of those little creases and essentially very, very hidden, and no one's going to be able to see it.
Okay, let's go back to YouTube. And
wow,
this, yes, some fire.
Yeah.
Does Vaser increase risk of lipo burn, or are there any other increased risks?
That's a great question. So, if I were to put this on that C, like I talked about before, and crank it up to 100, and did it for too long, then yes, it could cause a burn. Okay, so that's why you need to go to someone who has a lot of experience with the device, knows how to use it, and knows the appropriate settings. For me, for most of my patients, I put it on the Vaser setting. I put it on a 70%, especially because I want that fat to be viable. And when you do it this way, there's no increased risk of lipo burn.
If I only get high def lipo, can I do it awake, local?
Not with me, all right? There may be some other surgeons out there that'll do it. I don't recommend it. I do all of my high def liposculpture procedures under general anesthesia, okay? These are, procedures that take some time and they're very tedious. You definitely don't want the patient to be moving or, complaining of pain or anything like that. And you want to be able to really, really, think of it really like etching, right? You have to have very fine movements. You can't risk the patient moving around or having any issues, okay? So for all those reasons, I like to do it under general anesthesia. The other thing is when you do a lipo case, especially a large lipo case on your local, the only way to do that is to use the numbing medication, which is called lidocaine, all right? However, you have to be very careful with lidocaine, okay? Because there is such a thing as lidocaine toxicity. So if you give a patient too much lidocaine, that can affect the nervous system and the heart, and they can have potentially a heart attack, okay? So you have to be very, very careful. So when I do this under general anesthesia, I use 0 lidocaine. That means 0 chance of lidocaine toxicity.
How long will my skinny BBL take approximately?
So every patient's a little bit different, right? And it depends also on how many add-ons we're doing. Say, for example, you're doing a skinny BBL just straight up with Vaser and that's it. Or maybe we're doing a skinny BBL with the arms and the chin, and maybe you did whatever. So you might add some other things to it. And maybe you add high definition. If we're doing a high definition liposculpture, that's gonna take longer, right? So, but let me put it this way. If we're doing pretty much just a straight up South Beach butt lift, skinny BBL, and someone who has a BMI, say somewhere around 22, okay, with no add-ons, nothing else, it can take about an hour and a half to 2.
Why cord fibrosis or cording happen after Vaser, mainly on the waist area?
So can fibrosis happen after Vaser? It's mainly in the waist area, yes. All right, so once again, it has to do with the settings. So you're right. So in the same way that if you crank this up too high or you do it for too long, that can lead to lipo burns, right? in the same way that if you crank it up too high, or you leave it in for too long, or you're doing it superficially for too long, that can lead to potentially for fibrosis. So again, this is a lot where a lot of the surgeon experience comes in as well. So you don't want to crank it up too much. Like I said, you want to use that Vaser mode. You want to use it at 70. You want to see how much time you're in there. That's why I had the timer here. Like right now, when I was showing you the example, we did 18 seconds. But like I said, I typically do not much more than 15 minutes in the front, 15 minutes in the back. So you want to be cognizant of your time as well. So you have all those things controlled, the chances of fibrosis are less. Now, they're never zero, right? You can get fibrosis without using Vaser, without using anything, with straight up liposuction. So fibrosis is always a risk, and you can never bring that risk down to zero. Okay, but the way to prevent it after surgery is to make sure that you're using adequate compression, that you're hydrating adequately, and that you're getting your post-lipo lymphatic massage.
Are post-op massages evidence-based? Evidence-based? There is so much variability in records in the US.
There's definitely a lot of variability in terms of that. There's a lot of variability in terms of the data. There's also a lot of variability in terms of like how many massages, et cetera, et cetera, et cetera. So unfortunately, we don't have like the one definitive study, okay? We don't have like that double-blind, controlled prospective study in terms of massage, unfortunately. However, based on the experience of surgeons both in the US and outside of the US who have done thousands of cases of liposculpture, especially high definition liposculpture and BBL, okay? It has been demonstrated that post-lymphatic massages are extremely beneficial, okay? And I'm telling you, this is coming, not just from me, but from pretty much like the masters and the gurus, the people that invented these procedures, okay? For example, last year I went to see Dr. Rafael Hoyos down in Colombia. He invented high definition liposculpture. He's basically the godfather of this procedure. He's done pretty much the most in the world. And of course, he starts his patients on post-lipo lymphatic massages as soon as day one. And they get at least 20, okay? And that's similar for us here at Pure. So all of our Lipo 360 and BBL patients are going to have post-lipo lymphatic massages, and they're going to start on post-op day one, and you're going to get at least 20 minimum, perhaps more, but no less than that.
Can I do ab etching and a tummy tuck at once?
You can do some etching at the time of the tummy tuck, okay, for the right candidate. Not everyone's a candidate for this, okay? And when we do it at the time of the tummy tuck, it's like a soft etch. I'm not talking about six packs. I'm talking about like more women that are getting that kind of that feminine etch where we do like the one line here and the one, the couple lines through there, just to accentuate the abs basically, in the middle in a kind of soft, kind of athletic look. So you can do that at the time of the tummy tuck. Now, if you're gonna want something that's a little bit more etched out, more of that six pack, more of that like more extreme athletic look, then it's best to do it after your tummy tuck. So you do your tummy tuck first, get that skin nice and tight, and then come back about 3 months later for that, total, and you can do your total body high definition liposculpture at that time.
Are lipofoams are lipofoams necessary if you have an extremely tight fit faja?
I believe they are for the first 6 weeks, okay? So I like to put all of my patients into lipofoam for the first 6 weeks. Typically, I give them 3 foams. Excuse me. There's one in the front, 2 on the sides, and then there is a little triangle there for the back. And so they'll use that inside the faja for the first 6 weeks. After 6 weeks, then they can remove all the foams. They can tighten up their faja, and there's no need for foams anymore.
How long after BBL can you do Aveli?
Oh, great question. So Aveli. First of all, what is Aveli? So that is a device that we use to treat cellulite. We started this last year as well. We're super excited about it because what? It actually works. There have been so many other things for cellulite out there. These creams, injections, this and that. and nothing really works, okay? This is the first device out there that actually works. Why? Because it goes to the actual root of the problem. The problem is that you have these fibrous bands, these fibrous septae that are holding the skin down. And so that's what creates the dimple of the cellulite. So if you're able to directly go and release those bands, that releases the skin and therefore the cellulite goes away, all right? Now, can you combine it with a BBL? It's gonna be on a patient case-by-case basis, right? If you have an isolated 1 or 2 dimples, then I would say yes, I can combine that with your BBL because we're just, tackling, say 1 or 2 dimples on either side. It's all very kind of controlled and localized, okay? Now, if you have a lot of cellulite, okay, quite extensive cellulite, more like a severe cellulite, then it's gonna be too much to release all those bands and do fat transfer all at the same time, and the risk of what's called a blowout deformity goes up. A blowout is when you kind of release the bands, fill it up with something, for example, fat, and then you create this bubble. All right, you don't want a bubble. All right, so the risk for that goes up with the more severe the cellulite and the more bands that you're cutting. All right, so I do take these on a case-by-case basis. Certainly, if you're thinking about combining it, of course, let us know. Let your coordinator know. And then that way I can take a look at everything, look at your photos, do an evaluation, and then determine what's going to be the best course of action. Now, if you can't do it at the same time because it's too expensive or whatnot, then you can, after your BBL, you should wait 3 months, and at 3 months you can do your OPRI.
Okay, Doug, we're out, but we have a lot of questions asking about prices and booking and consultation. Okay. Can we do like a resume?
A big wrap up about that?
Yeah.
All right. So I'm not going to get into individual prices because every patient is a little bit different, and exactly what you're asking for may also vary as well, right? They have an add-on, this and that. So all these things are going to vary. So what's the best way to then learn about the pricing, right? The best way is to do a virtual consultation. That's actually going to be what I would say is the easiest, most efficient way of doing this. And because when you do that, we're going to hook you up with one of our patient care coordinators, and she's going to be able to answer every single question you can possibly come up with. All right, they're all super trained, they're all bilingual, English and Spanish, inglés y español. Okay, todas nuestras coordinadoras hablan español también, okay? Así que no tengan miedo, manden esa consulta virtual que los van a llamar y le van a contestar todas sus preguntas, okay? But where do you go? You go to our website, okay? Our website is www.pureplasticsurgery.com. And my great surgeon handwriting right there. So www.pureplasticsurgery.com. And when you go there, you're going to see a box. I call it a button, a box. And that's going to say virtual consultation. Here we go. Virtual consultation, okay? So you go to the website, you find the box, you hit the box, it's going to make you go through a questionnaire. It's going to ask you to submit some photos. You fill out every single part of the questionnaire, don't leave anything blank, okay? But it will ask you what procedure you're interested in. And there's some people that are interested in more than one procedure or whatever. Don't worry about it. Just put the main thing in there. Say, for example, you're interested in breast and BBL, okay? That's fine. It's not going to allow you to put both, but put one of them. Put either the breast or the BBL. It doesn't matter. But as long as you're able to fill out every single part of the thing and then send in your information and send your photos, that's going to come to one of our patient care coordinators. She's then going to reach out to you by phone. They're going to call you, okay? And they're going to be able to give you all the information that you need. They're going to talk about all the procedures and what can be combined, what can't be combined. They're going to tell you about pricing. They're going to tell you about absolutely anything that you need, all right? They're happy to spend all the time on the phone as needed to answer all your questions, okay? All right. Okay, everybody. All right, sounds good. Well, I'm so happy to be able to kick off 2024 with our first hump day here. I hope you guys got all the information regarding this device and why I like it so much. And now that's going to be part of your Lipo360s and your BBLs for everybody moving forward. All right? And I look forward to seeing everyone next week on Hump Day with Dr. Alex Earl. Take care. Ciao.